How to identify specific pathogens in cystic fibrosis infections. Imagine trying to find tiny invaders hiding deep inside the lungs of someone with cystic fibrosis. Detecting these pathogens is crucial for effective treatment and better health management. The process begins with collecting samples from the respiratory system, such as sputum, cough swabs, or even fluid from the lungs through a procedure called bronchoalveolar lavage. These samples give us a snapshot of the microbes present in the lungs. Once we have the samples, traditional microbiological culture methods are often the first step. This involves growing bacteria on special plates that support their growth. By observing the shape, color, and growth patterns of colonies and performing biochemical tests, labs can identify the suspected pathogens. Antibiotic susceptibility tests are also done to see which medicines might work best against the bacteria. But it's important to remember that cultures sometimes miss bacteria, especially those present in low numbers or those that grow slowly. To improve detection, scientists now use molecular techniques. Polymerase chain reaction, or PCR, is a powerful tool that amplifies specific DNA sequences of bacteria, making it easier to detect even tiny amounts of bacteria that might not grow in culture. For example, PCR targeting the RIK gene helps identify bacteria within the Burkholderia complex, which can be tricky to grow. Another method is 16S ribosomal RNA gene sequencing, which reads a conserved part of bacterial DNA to identify a wide range of bacteria, including those that are hard to culture. Mass spectrometry, specifically MALDI-TOF, is a rapid way to identify bacteria based on their protein profiles once they are grown in culture. Fluorescence in situ hybridization, or FISH, uses fluorescent probes to directly visualize bacteria in sputum or lung tissue, especially useful for studying biofilms, communities of bacteria that stick together and make infections more persistent. Recently, metagenomic sequencing has emerged as a comprehensive approach that sequences all microbial DNA in a sample, providing a broad picture of the microbial community without needing to grow the bacteria first. Innovative non-culture methods are also being explored. For example, detecting microbial cell-free DNA in blood plasma can reveal the presence of pathogens like Pseudomonas aeruginosa without invasive procedures. This approach can identify circulating bacterial DNA even when symptoms are mild or absent, offering a promising tool for early detection. Since many cystic fibrosis pathogens from biofilms, specialized techniques like confocal laser scanning microscopy combined with FISH are used in research settings to study these complex bacterial communities. Combining all these methods, culture, molecular diagnostics, and advanced imaging, helps clinicians accurately identify the specific bacteria causing infections. It's important to remember that diagnosing infections in cystic fibrosis is a complex process that often involves collaboration with specialized laboratories. Each patient's situation is unique, and healthcare providers consider multiple factors to determine the best approach. If you or a loved one has cystic fibrosis, always consult your healthcare team for personalized advice. Accurate identification of pathogens is key to tailoring treatments, preventing complications, and maintaining better lung health over time.